Okay, this talk's going to be about heart disease in Southeast Asian persons and about the story of Dr. Babu. Dr. Babu is my friend. He's an Indian physician. He's a very healthy guy. I mean, he's running around all the time. He can run 15 flights of stairs quite easily. He's very fit, energetic, cheerful, and with it, and smart. And so here's what happened. Well, first of all, a word about heart disease in persons of South Asian descent, like India, Bangladesh, Nepal, and whatnot. And by the way, yeah, that's what Southeast Asia means. There's what East Asia means, like China, Korea, Japan, Southeast Asia, Vietnam, Cambodia. South Asian persons have increased coronary artery disease, much more than you'd expect. And again, he looked totally healthy. And in my experience with persons from South Asia, they're very healthy. But they have an increased incidence of myocardial infarction, increased incidence of diabetes. They tend to have earlier age onset of myocardial infarction, despite having less obesity, less hypertension, and less use of tobacco. And so again, my theory, I talked about this in a previous lecture just recently, is they eat a lot of fried food and a lot of cooking oils. So that first picture was a picture of Dr. Babu, and then here's a conversation I had with him. He's a friend of mine. I hadn't seen him in about 4 months or so. He's about 65, real thin. And by the way, he told me to tell people about this. He wants people to learn from this. So I hadn't seen him in 4 months. I said, "Hey, where you been?" And he said, "I was dead. I had a myocardial infarction, coded, underwent CPR, was defibrillated. Then the cardiologist put in a stent. I was in cardiogenic shock for 7 days on a ventilator. The cardiologist used an Impeller cardiac pump from Abiomed, the company Abiomed that makes it, to maintain cardiac output. And then I had stunned myocardium. Initially, the myocardium was not functioning, the heart muscle, because of the heart attack. So the pump to maintain his cardiac output kept him alive. And I was real surprised by this. He's the last person I would expect to have a myocardial infarction. I said, "I thought you were a vegetarian." He said, "I am." He's skinny. He looks totally healthy. He was looking totally healthy, energetic, cheerful, talkative, the last person you would think would have a health problem. And I knew he's in great shape. He runs up and down 15 stairs like it's nothing, 15 flights of stairs like it's nothing. So I said, "There's got to be a problem with your diet. Do you cook with oils?" And he goes, "Sometimes." I said, "What about dairy?" He said, "Sometimes." I said, "What about in the future?" He said, "No more oils, no more ghee." He made it to complete recovery, had total return to normal ejection fraction, 55%. And he asked me to tell people his story so they learn from it. It's quite a story, too. He was driving with his wife. You'll see the movie. I strongly recommend you go to Abiomed and see that movie. Because if this could happen to Dr. Babu, it could happen to anybody. And the lesson from this is no meat, not one bite. No oil, not one bite. No dairy, not one bite or sip or any of it. The company Abiomed made a movie. You go to their website, abiomed.com. You'll see the movie of Dr. Babu's story. And just here's some pictures of when he was on the ventilator in cardiogenic shock for 7 days. That's a lot, 7 days. He told me that if he had gone to any other hospital, he would have been pronounced dead. This place luckily had really good cardiologists. They had the Impeller cardiogenic pump. They did a great job. The paramedics also that did CPR in the field did a great job of saving them. Here's what the cardiac Impeller pump looks like. It's placed with a catheter, transcatheter technique, and then it goes into the left ventricle, and then it pumps blood from the left ventricle into the aorta, and it maintains cardiac output until the heart can recover from the ischemic event. And here's Dr. Babu afterwards. He looked totally normal. You'd have never guessed anything had ever been wrong with him. So anyways, that's the lesson learned. It really matters. No oil, not one drop. No meat, no dairy. None. Zero. So anyways, he made a wonderful recovery and he's doing great and everyone's very happy about that.